And we are live. Hello, tribers. If you can see us, please let me know. Let me just check if our session is visible on the community. If any of you can see us, please let me know. Yes, we are live. Please let me know if you can hear me well and you can see the frame well. So, tribers, please let us know which city you're joining us from. Please tag your friends, all those who are interested, everybody who has registered for this session. We've already sent you an email in case you want to come back to this session. You will have a link in your email from Ahmedabad. Great. Good to know we have people joining us from all over India. And just to have a quick introduction of this session is going to be one of the most in demand sessions ever on Parent Tribe. And the topic for today's session is bedwetting tendencies in children. And for this session, we have with us Dr. Krishna Prasad. He is a consultant pediatrician who completed his MBBS from Government Medical College, Mysore, and got his MRC PCH from Royal College, London. He started his career in 2011 as a senior resident in pediatrics in Manipal Hospital, Bangalore. He later joined Motherhood Hospital, Sarjapur Road in 2014. He has also been practicing in Electronic City, Bangalore. He has a special interest in newborn care, diet, nutrition, growth, development, and infectious diseases. He is caring and has utmost patience in handling his kids. Welcome to the session, Doctor.
Thank
Any
you. Thank
opening
you.
thoughts for today's session?
Yeah. Thank you, Ms. Shweta. So, good afternoon, everyone. So, today we'll be discussing a relatively common condition that we see in kids. Uh, Actually, many kids wet the bed in the night, but very few parents end up, kind of seeking any help or guidance for it. So, they usually kind of feel very embarrassed. They feel that their child is the only one who's doing. So today we'll try to discuss a little bit about it and remove any kind of misconceptions, and hopefully give some good guidance for parents who are facing this thing.
Right. So, Doctor, what are some of the common causes of bedwetting in children?
So if we kind of look at it in a broad aspect, to begin with, we can look at certain genetic factors that play a major role in it. So, for example, if one of the parents used to wet his or her bed when they were young, there's almost a 40% likelihood that the child, himself or herself will be wetting the bed in their, in first. So next, there are a lot of other, hypotheses which has been described for bedwetting. One itself, that the brain maturation takes few years longer. Control is not achieved as well in the first 5 years, and some kids have a very small bladder, so the capacity to hold urine is very limited, so they end up passing very frequently. And some kids have an overactive bladder, so any small stimuli and they just they have to pass the urine, they're not able to kind of hold it. We also see bedwetting in kids who are very much deep in sleep. So when they do feel the urge to pass the urine, they're so deep in sleep that they'll not be able to get up and go to the bathroom. So they end up wetting the bed. In other sets of kids who have, for example, if they have some adenoids issue and they have a lot of snoring, so they have a very disturbed sleep. They keep fidgeting through the night. They keep getting up in between because they find it difficult to breathe. And this disturbed sleep and arousal mechanism also triggers bedwetting in the night. So and some secondary causes are also there for bedwetting. For example, kids with chronic constipation, since the pelvic floor muscles to kind of uh, achieve the bowel control and bladder control are very close to each other. Kids with constipation can also have this bedwetting as a feature. So these are your the kind of major causes that we see on our day-to-day practice, which causes the bedwetting in kids.
Right. Okay. So before we move on to our next question, I would like to announce that we will be having a giveaway in this live session. So, all of those who are watching the session, we will be posting a form immediately in the comment section right now. If you want to be eligible and if you want to claim a giveaway, please fill up the form that our team will be floating in the comment section, and two lucky winners will be winning a ladder, a pot seat ladder from Infanso, and one padded underwear from SuperBottoms. So, if you are a parent who's looking at potty training your child, then please fill this form immediately, which will be floating in the comments. Only those people who are attending the session will be eligible to fill the form and will be eligible for the giveaway from Infanso. So, moving on to the next question of this session. Doctor, at what age should bedwetting be a concern for parents?
So usually the upper limit that we consider would be around 5 years of age. So around 2 years we do start potty training for kids, and most of them achieve complete bladder and bowel control by about 3 to 6 months. But sometimes there'll be occasional mishaps, and they might be bedwetting, which happens during the day or night whenever they take nap. This can continue for about 3-4 years of age, which is acceptable because it won't be happening very frequently. But beyond 5 years of age, if there are any, even discrete episodes where the child is, wetting his or her bed, then it's ideal to kind of seek help. So even the incidence is almost around 15% in India. So around 5 years of age, when parents can come to seek help, or 15% of the kids would still be wetting their beds. This usually improves with time, and it comes down to around hardly 2 to 5% by 10 to 15 years of age. But that's a long way to be left untreated for. So I think by 5 years is the upper limit, beyond which parents should come down and kind of meet a nearby doctor and seek help for it.
Okay. So, we often, as you mentioned in your previous answer, that parents are concerned but often don't speak out about this issue many times, right? How can parents be supportive and reassure the child who's experiencing bedwetting?
Yes. So, like you said, this is a problem which is uh, kind of affects the child himself or herself, and they're not very comfortable with it. So, we need to provide a lot of reassurance to the kid that it's not, something that they're doing wrong, or it's not something that they have full control over, and they're not to blame for it. And scolding them or punishing them or even shaming them, that the bedwetting thing aspect is has a lot of negative consequences, and it leads to self guilt and very poor self esteem, and can lead to long term behavioral issues as well. So obviously no child likes to wet his or her bed, and they're not even doing it as a purposefully. They don't want to learn to hold or something like that. So first is we need to educate the child, about bedwetting, that there are other kids who do go through this, and eventually with time, it will get better. And we need to motivate a lot with therapies for them, because initially whatever treatment that we do is more of non-medical treatment, where we try to set into certain routines and cycles, in terms of fluid intake or how many times they need to go to the bathroom, and they need to use the restroom before going to bed. So we need to motivate them that this has to be a routine. He or she has to use the bathroom before going to bed, and this has to be sustained in the long run. So
Yeah.
overall, it takes few months to kind of achieve any significant difference in terms of bedwetting. But we should never blame the child and keep motivating. Even if there is a bedwetting incidence during the therapy, we should make sure the child is not disheartened, and he or she continues with the therapy. There will be a lot of relapses in between, but we have to keep motivating them to kind of follow through with the whole treatment.
Okay. Are there any lifestyle changes that a parent can introduce to the child, Or basically the question is, is there any particular lifestyle habit that will cause bedwetting in the child, and what are the habits that parents should be inculcating in a child as far as lifestyle changes are concerned to avoid bedwetting?
Correct. So, a lot of sugary drinks kind of tend to overstimulate the bladder, and sugar is a very potent kind of a diuretic. So, sugar draws in a lot of fluid, and that makes them kind of pass urine more often than usual. So, cutting down on sugary stuff helps a lot. And definitely we don't want to give any caffeinated drinks to kids. So generally also caffeine is not recommended for kids, but sometimes many parents end up giving a little bit of coffee or tea because they drink the same thing and the kid always asks for it.
Yeah.
But caffeine also is a big kind of no for kids, even for bedwetting. So the other kind of lifestyle changes would be we need to make sure the child frequently goes to the bathroom and empties the bladder. Even though the child may not have the urge to pass urine, as a routine and as a habit, we have to make sure that every 2 hours or so, the child goes to the restroom and empties out the bladder. And one more thing would be to make sure the child passes urine before bedtime, so that the bladder is completely empty and less likely to have any kind of stimulation or urge through the night. And we can also try to regulate the overall fluid intake of the kid. So let's assume the child drinks this much amount of milk and water and juice and everything. So roughly we have an idea whether the child takes about 1 liter, 1.5 liters. We can split that overall fluid intake into different timelines. So let's say morning around 8 to 12, the child can take about 40% of the daily intake, and 12 to 4 takes another 40%. But in late evenings from 4 to 8, we restrict it to only about 20%. And so keeping a limit on the overall fluid intake towards the later part of the evening, so that they don't have to frequently visit the bathroom, they'll, will also go a long way in cutting down at least the incidences of the bedwetting episodes.
Right. Okay. And can there be any underlying medical conditions in which there is bedwetting, or bedwetting is a symptom of at times?
Yes, so most of the times these secondary causes are what we usually encounter. So, like I said, kids with constipation might actually have this bedwetting thing. So, whenever any child with bedwetting comes, we always ask if the child is constipated. Or even in kids with constipation, the parent may not come out with the presenting complaint that the child also has bedwetting. So, kind of we always have to ask the other question. And kids with this enlarged tonsils and adenoids may have the snoring and disturbed sleep, and sometimes occasionally they will also wet the bed. So all these we kind of asked about and treated. But primarily, most of the times, simple history will kind of enlighten us on what could be the cause. So we can just ask specific history regarding the urination, whether the child has any kind of burning pain while passing urine. So we can find out if there's a urine infection that's triggering this. We can ask if the urinary stream is not that good. So the maybe the child is not able to produce enough pressure to pass a good stream of urine. Sometimes there'll be dribbling of urine because the bladder doesn't completely empty out. There'll be some amount of residual urine. So even after passing urine in the bathroom, the child continues to wet the undergarments because of the dribbling. So all these kind of tell us whether particular kidney or bladder issue is there. We can ask if the child has predominantly daytime symptoms or nighttime symptoms. You know, Specifically, sometimes children wet the bed when they take a nap during the day as well. So that could also indicate certain underlying causes. In terms of examination, some rarer causes would be we basically look if there's any kind of deformity in the backbone. So if the backbone, the spinal, at the spinal level, if we are seeing any changes. Sometimes we see a sacral dimple just above the buttocks, and we also see a little bit of tuft of hair just above the buttocks. So all these could indicate there's a spinal cord abnormality, and we can kind of investigate in that direction. And if we feel there are urinary symptoms, then obviously a simple urine analysis test can be done. and that confirms the diagnosis if there's an infection. We can see sometimes if there's kidney issues, there'll be loss of protein in the urine. So if the urine analysis is showing some protein, we can say, okay, there's a kidney issue. Sometimes we see sugar in the urine. So these are all abnormal findings. If we see sugar or protein in the urine, then we can rule out particular underlying kidney issues. And if we feel there's a need to do some blood tests because there's a kidney problem, we can do a renal function test, ultrasound abdomen, and if any spinal cord abnormalities is suspecting, we sometimes do MRI of the spine. Those are very rare causes, but most of the times with a simple history and physical examination, we can kind of pinpoint the common stuff. Usually, bedwetting is mistreated as urine infections. Urine infection is not one of the top causes for bedwetting. Most of the doctors end up, thinking that because of an infection, the child is wetting his bed. But that's not as common, and obviously, a urine analysis will quickly rule that out.
Okay. Okay. So before moving on to the next question, I would like to remind all our viewers that we have a giveaway going on right now. We will be giving away two potty ladders from Infanso and the padded underwear from SuperBottoms. So all those who are watching this live session right now, we have floated a Google form in the comment section. I do see certain comments that the form is not opening, but we already have a lot of responses on the form, so it is definitely opening. Please paste it in the incognito mode and try to fill the form again. We will be closing the form at the end of this session. With with all the positive feedback we are already receiving about this session, let's move on to the next question for our doctor. So, doctor, are there any specific treatments or therapies available for children with persistent bedwetting?
Yes. So usually we try to start with the non-medicated options like the motivational therapy and stuff, where we try to do a reward system for the kid. And if the child stays, dry in the night, or rather does any of the steps like we told, that empties his bladder before going to the bed and stuff, then we give a reward like a star or something. And if all this motivational therapy doesn't, work for first 3 to 6 months, then only we end up going with the specific treatments like the medications. So there are a couple of them in the market which have been there for quite some time. So one is something called desmopressin. So this is the most commonly used drug for bedwetting. It's very safe, and we don't get much side effect. What it basically does is it helps in reabsorbing water at the level of the kidney itself. So not much urine is produced or goes into the bladder. This is very useful for kids who have predominantly nighttime bedwetting. Doesn't really help for the daytime ones, but for nighttime bedwetting, it's very useful. It comes as a chewable tablet, so compliance is quite good, and most of the kids accept it very well. So we give it like about 1 hour before bedtime, so that it has the effect, and the child is able to stay dry through the night. And the minimum duration we do is about 3 months, before which we'll not be able to tell whether treatment is working or not. So when we do it for a period of consecutive 3 months, and we assess the response depending on the incidences have come down or not, and based on that we can either taper the treatment or continue on for some more time. So we usually ask the parents to maintain a voiding diary where they enter the details of these bedwetting episodes as to which day it happened, what time it happened, what was the fluid intake during that day, and any other triggers were there or not. And post medication, if the number of incidences came down or not. So it takes about 3 4 months before we can assess that. Only time we need to avoid the medications for bedwetting would be when the child is having acute illness like fever or vomiting, diarrhea. So that time these drugs are not recommended to be used. And we also have other drugs for daytime bedwetting or daytime frequent passage of urine. These are usually because of an overactive bladder. So the bladder fills up, but the child is not able to hold and has to frequently go to the bathroom. So we do get medicines like oxybutynin, which basically relaxes the bladder, so the holding capacity of the bladder goes up, and the child may not feel the urge to pass urine that frequently. But most of the times, as a standalone therapy, we try to avoid giving only the medication. It's always used in conjunction with either kind of this alarms that we can use, or the motivational therapy. So in conjunction with the alarms and motivational therapy, the pharmacological medication that we use, it gives much better results.
All right. Okay. So let's move on to some of the viewers' questions that we have. The first question is, my kid has hardly peed on bed during night since 2 years, but sometimes accident happens due to some dream he sees. How to deal with it? He is currently 3 years old.
So, like I said, so it is common to have such accidents till about 5 years of age. So I think if the one-off episodes is happening only once in a few months, then can we, can wait and watch. And before 5 years, we never evaluate or kind of treat for it, and we can't really do much about it. It does happen in deep sleep, or when they have a disturbed sleep, they do wet their bed. So can wait till 5 years of age.
Yeah, for them to be properly potty trained.
Yes, potty training will start by 2.5, but the complete bladder control may take little longer time. Occasional mishaps are acceptable till 5 years.
Okay. Okay. The next question is, my kid is 19-month old. I tried to pee train him, but he pees only in his undies. I waited for more than 2 to 3 hours, but he controls. The one and once he's out of control, he cries and insisted me to put on underwear, and then he peed after putting the underwear. So I stopped training him. How to tackle this problem?
So actually, the trick is, even when we advise parents for potty training or the bladder bowel control, so we usually tell the parents first we should teach the child that he or she has to do it in the bathroom. So we say that the child can do it in the diaper itself, but first you take him to the bathroom and tell him, okay, you do the urine, you pass the urine here, you pass the stools there. So they need to realize that they can't do it anywhere in the house or outside the house. Whenever they feel the urge, they need to tell it, and you take them to the bathroom and do it in the diaper. Then you change the diapers. That's how you begin with. You can't completely achieve daytime dryness so easily. And then night dryness maybe sometimes a little easier. Maybe if you keep them dry. So daytime basically they're distracted. So they don't tell it till the last moment sometimes, and they do, soil their dress. So, but I think the kid is kind of, going in the right direction because he's asking for it and he's passing in that. So I would say continue the same. Maybe I think diaper will be an easier option, so that you don't have to change the clothes every time, or wash the kid every time he or she passes the urine. And post that, once the child is accustomed to going to the bathroom to pass the urine, then you can start asking them to do it, without the undergarments or without the diaper.
Okay. The next one is, how to make kids understand that peeing on the bed is not good in a gentle way.
So again, it depends on the age group. For them, it's since it's completely involuntarily, you can't really kind of make them realize. They also feel bad. They are also ashamed that they've done it, and they don't like. They do feel that sense of that this is dirty, and you need to change them, wash them up, change the sheet. So, what you can basically is do the same tips that we discussed. Cut down on the fluid intake. In the later part of the evening, make sure they empty the bladder before they go to the bed. And maybe for few months you can use these protective, the bedding and the sheets, the absorbent sheets, for some time, so that you don't actually end up spoiling your mattress. And as a hygiene point of view also, I think that can be started with. Nothing that you have to explain to the child, they already know it. It's just that you have to treat it in a different way, where they restrict the fluid intake and empty out the bladder before they go to bed.
Okay. Uh, yes. So, doctor, are there any practical tips for managing bedwetting, such as, of course, you mentioned all of that in all your previous answers, something like protective bedding or alarms. So, in case we have
Yes.
missed out on any of those, could you please shed some light on that?
Yes, so we do get these alarms, the protective bedding and the sheets we already talked about. We do get these alarms, which again we use it if all this motivational therapy and the reward system and all is not working out. Then we start out with actually alarms even before going for the medications. So the alarms are basically, they come with a sensor which you kind of stick onto the undergarment, and when the child passes urine in the middle of the night or something, initially as soon as the sensor becomes wet, the alarm goes off, and when the alarm goes off, the child actually ends up getting up. So when the child is aroused, he or she can be able to hold the urine, and then we need to kind of train the child that when he gets up because of the alarm, they have to go to the bathroom and empty the bladder there, then again kind of come back and then go back to bed. So this sometimes has a lot of failure and relapse rates, because the child has to be motivated enough to end up getting up because of the alarm and going and passing urine. It disturbs their sleep. Sometimes when the parents' sleep is disturbed, because the alarm has to be loud enough to awaken the child. So it's based on this principle of reflex conditioning. So wetness triggers the alarm, and the sound awakens the child. So if it happens on a frequent basis, the child is wetting his bed very frequently, a few times in a week, the alarm thing can be very well trained into the child. And usually again we use this in conjunction with the motivational therapy and all. um, it needs about 2 to 3 months before we can achieve a good amount of nighttime dryness with these alarms. So never try it as a standalone therapy. Always use the alarms either with medication or with the motivational therapy
Right.
together.
So this is something new. I mean, these alarms come as a potty training device or probably a bedwetting preventing device for children, is it? Or are they our regular clock alarms? But you said
No,
there
no.
is a sensor attached to it.
Correct. So there are separate devices specific only for bedwetting. So the sensors are kind of reusable and washable. So once the sensor becomes wet or something, you can kind of wash it, clean it, and kind of use it again. It's a simple device, but it's only specific for bedwetting. So there are few suppliers for it. So if you get in need be, the doctor will kind of specifically get in touch for it and order one
Right.
for the patient.
Okay. So the next question is, my kiddo is 3 years now, and at times he's peeing but not waking up too much, which initially he used to. Will that cause any problem?
No, usually no. So 3 years is still quite a young age. So they will not have complete control. Nighttime, especially, they might end up passing urine. So just cutting down on the fluid intake and cutting down on sugary drinks and all this caffeine related stuff should do the trick. So if it's still 3 years and not that frequent, it won't lead to any long term problems at all. So we only evaluate for any underlying causes if it's very frequent and after 5 years of age, because we don't want to over investigate in a young child when most of the times usually nothing will be found. So we wait almost till 5 years at least.
Right. Before thinking that the bedwetting is actually concerning.
Yes, correct. Till five
Right.
years, you can definitely wait at home. No need to seek any help, even if there are a few episodes happening.
Okay. So, doctor, would you please like to summarize everything for us once? Because we've covered so many points, just in case our viewers have missed out on anything. Could you please
Yes.
summarize it for us?
So, generally, bedwetting, like I said, beyond 5 years of age, we want to investigate. So, a lot of different causes for bedwetting. If you kind of want to classify that, so there are primary causes which is inherent to the child itself. Sometimes we see only daytime bedwetting, which could just be because of an overactive bladder or too much of fluid intake. So by cutting down the fluid intake and sometimes even starting medication, we should be able to achieve this daytime dryness quite easily if it's persisting beyond 5 years. And if it's only nighttime bedwetting with no other symptoms at all, that's a primary nocturnal cause, for which most of the times it's usually genetic and there won't be an underlying issue that we have to treat for. But if there is both day and nighttime bedwetting, then that could indicate a underlying pathology. So there might be a kidney issue or something, something to do with the kidneys or the bladder, and we might have to investigate certain blood tests and scans and all. So there's also something called this secondary bedwetting, in which the child would have achieved dryness both in the day and night, but after a period of let's say 6 months or so, suddenly he or she starts to wet the bed again. So after achieving dryness for a period of 6 months, if the child starts wetting the bed, most of the times it's usually stress at home or school which triggers it. So there could be some discord among the parents. There could be sibling rivalry if there's a new baby in the house, and just for attention seeking as well, this bedwetting as a habit starts. And sometimes there's stress at school. There's a lot of discipline either with the school teacher or with one of the parents who's being very kind of strict with the scholastic pressure and all. Bedwetting might start as a secondary cause much later in the lives. Sometimes other reasons would be same thing, this constipation. That's one of the common causes for bedwetting, and snoring, mouth breathing is there. We try to rule out if the disturbed sleep which is causing it. So these would be the secondary causes for bedwetting, which occur once the child has already been trained and has been dry for a period of more than 6 months. So definitely seek help for it. You don't have to kind of think that it'll go away or it's happening less frequently, because about 10-20% of the times there would be an underlying cause which is very easily treatable and correctable. So that itself solves the problem. And rarely, if there's an underlying pathology, again, we don't want to ignore it for a long period and have issues, because if the kidney issues, we don't want to wait too long to treat for it. So a simple, quick checkup with your doctor, who can do an examination, ask for relevant history, and maybe a simple test like urine, urine routine or urine analysis will rule out most of the causes. So, and then you can be rest assured and probably do with the therapies at home itself. So seek help beyond 5 years of age if the child continues to wet the bed.
Okay. Doctor, one of the questions we are getting a lot is, what are these devices, the alarm devices? Are they available over the counter, or would you need a doctor's prescription for that?
So there's no prescription required. Unfortunately, they're not available over the counter because it's a very kind of niche market for it. So you need to get in touch with the market, the manufacturer directly, and usually there is a kind of distributor for it. So if you go through the hospital, probably it's easier to procure it. Otherwise, not easy to get around. It's a very simple device, but yeah, nobody sells it. Nobody goes asking for it. So if beyond 5 years of age, if the regular behavioral therapies are not working out, then before starting or considering medication, the doctor can probably get in touch with one of the hospital suppliers, the one who supplies all these medical devices to the hospital. They'll be able to kind of procure the desires for you. It's not very expensive, also hardly cost around 1,500 rupees or so, and reusable. So, but yeah, it's easier to procure via the hospital through the doctor. No direct contact though.
Great. What an insightful session this has been. We are already seeing a lot of positive comments and how useful this session has been to all of you. Just to reiterate everything, we have a giveaway going on within the session right now. We will be giving away 2 ladders from Infanso and padded underwear from SuperBottoms, which are potty training pants. So please fill the form which is floated in the comment section right now. This form will be closed at 5 p.m. today. So please ensure that you are filling that form so that you are eligible for that giveaway. With this, I believe we are at the end of today's session. So, Doctor, do you have any closing thoughts for us today?
So I would only say always try to kind of motivate your kid to kind of stay dry. So even if a child is not able to stay dry, it's okay as long as he is, he's doing all the behaviors required to stay dry, like he's emptying his bladder before, going to the bed or restricting his fluid intake in the evening. You should always encourage those positive behaviors, because those will eventually lead to, reduction in the incidences and child being able to stay dry. So always try with this reward system, which is like a delayed gratification. Give them stars for doing a particular task, or consuming less fluid, or using the bathroom frequently. If he or she collects 3 stars, maybe he gets a chocolate. If he or she collects 5 stars, they get a toy. So something, you can negotiate with the child what are they actually looking for, which kind of toy they're wanting. If it's a very big toy, you can say, okay, you collect 10 stars and you get the biggest toy that you're asking for. So try with these kind of motivational stuff which the kids can look forward to, and they'll be quite eager and keen to work on them. So most of the times with non-medicated options itself, we should be able to achieve dryness in kids if you do it in the right way.
Okay. So, with that, we have come to the end of today's session. Thank you so much, Dr. Krishna, for sparing your valuable time and joining us here in this session and answering all these questions, which our tribers have been waiting to hear from you. Thank you so much for being with us here today, and we are looking forward to have you soon again on the next session on some other exciting topic for our tribers. Thank you once again.
Thank you. Thank you.
So, with that, it's a wrap on today's session. Thank you, all the viewers, for tuning in. Stay tuned for more such exciting sessions just on Parent Tribe by SuperBottoms. Thank you so much.